You're listening to Powbox Weekly, fully automated.
And I'm Jen. I read breach reports so you don't have to. Well, actually, you still have to. Sorry.
I'm Alex, healthcare IT guy who keeps hoping one week the news will be boring. This is not that week.
Is it ever?
Fair point. So let's start with the FBI's annual Internet Crime Report. Healthcare is officially the most targeted sector for ransomware in 2025.
Number one. We're number one.
Not the trophy anyone wanted.
But not surprising either. The logic is simple. Attackers go where the pain is highest. Hospitals can't just pause. Every hour of downtime is patient care on the line. That pressure makes people pay.
And it wasn't just ransomware. Business email compromise was actually the most damaging attack type overall.
Which tracks. BEC doesn't need malware. It needs one person to trust the wrong email. And in healthcare, where coordination happens constantly over email, it's a rich target.
So the takeaway here, ransomware gets the headlines, but email compromise is quietly draining accounts.
Both deserve your attention. Neither is going away.
Speaking of ransomware, OCR just announced 4 HIPAA settlements, all tied to ransomware incidents. Over 427,000 individuals affected.
And the settlements totaled $1.165 million, which, honestly, for 4 organizations, that's not catastrophic. But it's the principle.
OCR Director Paula Stannard made the point clearly. Implementing the security rule before a breach isn't just the law. It's your best shot at preventing or surviving an attack.
Right. These weren't fines for getting hit. They were fines for not being ready.
Risk analysis, access controls, the basics.
The unsexy stuff that saves you.
Meanwhile, Medtronic confirmed a cyber attack this week. Shiny Hunters, the group behind it, claims they stole over 9 million records.
And they're doing the classic extortion play. Pay up or we publish.
This is the shift we keep seeing. It's not just encrypt and ransom anymore. It's steal and threaten.
Which changes the calculus. Even if you have backups, even if you can recover, your data is still out there. That's the leverage now.
So what's the defense?
Layers, encryption, segmentation, monitoring for exfiltration, not just malware. And honestly, assume breach. Plan for what happens when, not if, someone gets in.
Let's talk about Powbox's new report, the Healthcare Email Security Maturity Index.
This one's a gut check. They surveyed 170 healthcare IT leaders across 8 dimensions of email security.
And the numbers are sobering.
58% of organizations were breached through email in the last 2 years. 64% have been hit by an AI-generated email attack.
But only 38% have AI-based defenses fully deployed and monitored.
So the attackers are using AI, and most defenders aren't keeping up.
The report maps organizations into maturity tiers. It's a good benchmark if you want to see where you stand.
Links in the newsletter. Worth the download.
And finally, Absolute Dental, a Nevada-based practice, just agreed to a $3.3 million class action settlement after a breach earlier this year.
$1 million lawsuits are becoming routine. That's not an exaggeration. We've seen it over and over.
And it's not just the fine. It's legal fees, it's reputation, it's years of fallout.
The breach itself is just day one. The cost curve keeps climbing long after.
So let's bring it together. FBI says healthcare is the top target. OCR is settling ransomware cases left and right. Medtronic's dealing with extortion. Most organizations aren't ready for AI-driven attacks, and lawsuits are stacking up.
And the through line isn't bad luck. It's bad configurations, blind spots, gaps that were fixable before they became expensive.
Risk assessments that didn't happen. Defenses that weren't deployed. Policies that weren't enforced.
The good news? Most of this is preventable. Not all of it, but most.
That's the work.
That's always the work.
Thanks for listening, everyone. Stay safe out there.
And check your email security settings. Seriously.